Okay, going back to the reason I came up with the ideas about the big fat tongue was going back to my history. I had anesthesia training in the Navy, and one of the things in the Navy when you're in anesthesia, when you're putting somebody to sleep, you look at the airway, you look at the tongue size, and can you manage that airway? And one of the big issues is the size of the tongue. So during my period of time when I was learning about this, there was a physician named Isono who published a study based on the difficulty of intubating somebody and talking about the discrepancy with the size of the tongue and essentially the size of the oral cavity, whether upper and lower arches, and the difficulty of doing anesthesia. And so that is where I got the idea of the discrepancy between the size of tongue and essentially what I call the size of the box, which is the oral cavity. So in observing this over a period of time, I looked at it and say that is one of the major issues. When I first designed the tap, I did it so that we only touched in the front of the teeth, touched what we call anterior guidance, with no touching in the back. So we had a very open bite in the back, and fortunately for me, and serendipitously, that is where the tongue moves. So if you look at a tongue, typically you see that the tongue goes sideways in between the teeth, and that's where you see the scalloping. So these are it's a tongue size discrepancy that you see. The scalloping, the area in the middle of the tongue can go to the palate, but typically all the tongue sits below the palate and goes out over the teeth. And so that's where I got the idea, the concept of big fat tongue. And then when I looked at that and looked at the research, although they kept records of it, they never published it, but all of those devices were made with a very fairly open bite, which allowed room for the tongue, no matter what size of tongue. If it was a small tongue, it certainly fit in there, but particularly with big tongues, that's why I think we had such good success with that.